Hi everybody, Dr. Brett, Advanced Pain Centers, Singapore. I created this for my patients at Advanced Pain Center to help clear up some of the information out there that can really just sort of overwhelm us. It's it's important to decrease our stress and anxiety and fear levels at this time, especially as it relates to our immune system. That's really the ultimate goal of this is to help clear up some of that information, make it so that we're able to see things for what they actually are, and in doing that, gain some power in what we can do to strengthen our bodies and our families' bodies through things that we do have control over. So first of all, what do we know so far? It's affected about 2 million people, infected 2 million, 230,000 plus deaths so far. Some countries have yet to peak in these cases. We know that it spreads through the air and off of surfaces quite easily. It's very infectious. We'll discuss why that is. We know there's no vaccine currently available. There's a lot in development right now, but keep in mind we also do not know if the strain will mutate, as is the case with all flu vaccines every year. We know that this is affecting particular groups more than others, and that's something I really want to spend a lot of time on. And because it helps us to learn what it is we can control and do for ourselves, that makes us less susceptible to either getting infected or acquiring the more serious side of this infection. So what does COVID stand for? CO, corona, VI virus, D, disease, 19 for the year we discovered. It's also known as SARS-CoV-2. SARS stands for Severe Acute Respiratory Syndrome. So those two are interchangeable. Now, what's the difference between this and the flu virus? The structure of this particular virus is different than the influenza. You're actually looking at a picture of the SARS-CoV-2, COVID-19. That's the yellow. Surrounding is human cells. The body has trouble recognizing it because it's something it hasn't been exposed to a whole lot. We have been exposed to some degree with SARS and MERS. However, again, as far as the common virus or the common flu of influenza, it's not even close to the level of exposure. So our bodies just are not equipped to really handle it. We believe this started in bats, transferred to something closer to humans, another mammal, and then to humans. We say that we can't control the virus, but we can control the host. This sums up the reason why I want to do this in the first place, is that although there's not much we can do outside, we can control what's going on inside. We are the host. We have full control over what we do to our own bodies and our families. So making that stronger is our best chance at, again, not only getting infected, but fighting the infection. Now, one of the studies that I love to quote in this that illustrates this perfectly is in 1991, the New England Journal of Medicine, the most prestigious journal of medicine. They took 394 healthy people and they dripped common cold virus into their nose. So this is the exact same exposure and the exact same virus. What they found is that the people that got sick were the people with high levels of stress hormones, epinephrine or norepinephrine. So it's a very significant finding in that the more stress we have, the more likely we are to get sick, which really highlights the importance of keeping ourselves as healthy as possible during these stressful times. This could be extremely stressful for a lot of people, which of course is snowballing and making things worse, bringing down the immune system, making us even more likely to get the infection plus a more serious side of this infection. So how does this spread so easily? One of the main reasons this spreads so easily has to do with the shape of the virus. So the outer surface of the virus is spiked, and it attaches to particular cells or receptors on these cells called ACE2 receptors. Now, the highest concentration of ACE2 receptors on our cells are in the mucosal layer of our nose and throat, as well as the most are in the lungs, which obviously connects with the most severe symptoms being in these areas. Another interesting fact is that the GI tract also has a high level of these particular receptors, which is something they're starting to see in a lot more of these patients with GI symptoms, gastrointestinal symptoms like diarrhea. Factors that make us more likely to contract COVID. So this is what I was referring to earlier as probably the most important part of this presentation. And that has to do with what are called comorbidities. Basically, underlying conditions that we could have before we are infected that make us more likely to not only get infected, but acquire the more serious side of this virus. So cardiovascular disease, diabetes, obesity, hypertension, any kind of lung issue, asthma, emphysema, chronic pulmonary disease, these are all red flags as far as people that are experiencing these side effects or these more intense symptoms and, of course, death. A doctor in New York treated 270 patients, and he said the best outcomes were from those under 70 and those non-obese. Some statistics coming out of the US. Now, something to keep in mind for anyone listening in Singapore has the US and Singapore have very close statistics in a lot of these like underlying health conditions like diabetes, heart disease. So although, again, this is taken from the US, you can pretty much say that it's going to be similar here in Singapore. 60% have at least one underlying health condition of adults. In a study of 399 people, 79% that had one of these underlying conditions had a much greater chance of requiring intensive care, respirator, or even of dying. Some statistics taken from China on a study that saw 72,000 different patients and case studies on this, so a decent size. 3% 80 years or older. Most of the cases, you're going to see 87% of the cases 30 to 79 years old, 8% in their 20s, and then not too many in their teens or younger. Vitality rate, you can imagine that the older you are, the higher the vitality rate. And it seems to affect also males more than females. A couple of the next slides here are going to go through some of the symptoms that you might not know about or are less commonly written about in the news. Loss of smell or taste is 30% of the people are testing positive for this. I just read something from the UK on people that actually recovered from COVID-19 weeks ago. Many still have not recovered their sense of smell or taste, so showing signs of it lasting quite a while. Some eye symptoms, things like conjunctivitis, chemosis, euphoria. So these are just discharges from the eye, irritation of the eye, excessive watering of the eye. So another sign that there's a possibility of another sign or symptom that you might not have known about before. Now, the other thing that makes this virus more dangerous than some others has to do with its incubation period. So SARS, for example, the incubation period was much less, and that just means that the symptoms would start being expressed or shown a lot sooner, which allowed us to take them out and be able to separate these symptomatic people quicker, and it didn't have the chance to spread as easily. With COVID-19, the average is five plus days in order to start showing symptoms, but it can be up to 11.5. So imagine it can be almost 2 weeks before you start showing symptoms, and some people really don't show symptoms at all. Some of the ways that it's spreading we know as on the top of surfaces. So How long does it last on particular surfaces? Plastic or steel is about 72 hours, cardboard 24, and airborne is 3. So of course this is the big reason why we want to wear masks when we leave, is the virus being able to survive in the air for up to 3 hours. It's easily killed with antibacterial agents or alcohol. 60 to 80%, about 75% is that sweet spot for alcohol. When you wear a mask, it does a couple other things as well. First of all, you can't touch your face as easily when you have a mask on. And we're finding that even just by breathing out, we're shedding some of the virus. So it also helps to prevent spread that way. Another way to transmit the virus is through fecal-oral route, which again has to do with touching our face quite a lot. So a significant portion of coronavirus patients are experiencing diarrhea, nausea, vomiting. The particular receptor that I mentioned has a high volume in the lungs and mucosal layer of the throat and nose. Again, it has a lot of receptor sites in the GI tract. So there's no doubt that there's going to be a lot of virus in the GI tract for people infected. And in fact, they're showing that even if it's not in the lungs, 25% of these patients are showing that it is in the GI tract. That concludes the first part. In the second part, I want to talk about some of the things we can be proactive in helping to strengthen our immune systems, make us stronger so that perhaps that if we are exposed, we don't get sick. And if we do get sick, whether it's COVID-19 or anything, our bodies are equipped to fight. Right now, we have a very good opportunity. I know in Singapore, we have a lot of extra time on our hands being at home, and as in most places in the world. So this is a really good time to take stock of our health and really look at possibility of changing some of our habits and some of our family's habits. You know, time to start eating really well, thinking well, sleeping well, catching up on sleep. And, you know, we have lots of time to go out for these walks. In Singapore, we're still able to do that. Just get out and stay active during this time. You know, we need to combat this sense of anxiety and fear it's pretty much all over the place. We have to actively work against sort of succumbing to that. And, you know, it will help our immune systems tremendously to do that. Thank you for listening, and please look out for part 2.